Welcome, everyone. Thank you so much for joining us for today's Caring for the Caregiver webinar. I wanted to note that we do have CART captioning available if you click on the CC button in your bottom right-hand corner. And we also will be posting in the chat a link for an external CART window if you would prefer. And we also do have ASL interpreters available for today's webinar. And this webinar is presented by the Executive Office of Aging and Independence and the Mass Tech Collaborative. Today's topic is the Emotional Guide to Caregiving, Tools for Stress, Resilience, and Support. My name's Liz Gallagher, and I'm the Strategy and Analytics Manager at the Executive Office of Aging and Independence, and I'm thrilled to welcome you to this important discussion. So providing care for someone you love can be deeply meaningful and rewarding, but it can also bring emotional challenges that deserve attention and support. This May, as we recognize both Mental Health Awareness Month and Older Americans Month, we're taking an hour to focus on you as the caregiver. So this year's Older Americans Month theme is Champion Your Health, which highlights prevention, wellness, self-management, caregiver roles, and community partnerships that support healthy aging. For caregivers, championing your health includes recognizing your own stress, caring for your mental health, and seeking support before you reach a breaking point. And by showing up for today's webinar, you're already taking an important step towards supporting your own well-being while continuing to care for someone else. So we are thrilled to welcome Dr. Julie Norstrand as today's featured speaker. So Julie is an Eldercare consultant and the founder of Help My Aging Parents, LLC. She holds a PhD in social work and a Master of Social Work from Boston College, as well as a Master of Science in Clinical Psychology. Dr. Norstrand's work focuses on caregiving, caregiver well-being, aging services, social connection, and planning ahead to support older adults as their needs change. She served as a commissioner and advisory board member at the Newton Council on Aging, an adjunct professor at Regis College, a board member of the Life Planning Network, and currently serves on the Newton Wellesley Hospital Elder Council. So today, Dr. Norstrand will be exploring what it means to be a caregiver, the signs and impact of caregiver stress syndrome, common emotional stressors that caregivers face, and ways to manage stress more effectively. She'll also highlight services and resources that can help caregivers navigate challenges, strengthen support systems, and care for their own well-being. And we'll also be joined by my colleague, Deanna Nourai, who's the Director of Public Health Policy and Outreach at the Executive Office of Aging and Independence, who will highlight for us Massachusetts-specific state resources available to support mental and behavioral health. And one quick note for those attending live, please feel free to post your questions in either the Q&A box or the chat. And you can also submit your questions anonymously if you'd like. One note, please do not include any personal or identifying information in your questions. And we will have dedicated time at the end of the session to address your questions. And with that, I will turn it over to Julie.
Hello, everyone. Thank you, firstly, so much for inviting me to come and speak today about this very important topic, as the emotional struggles that many caregivers experience is really such a critical issue. And through my work consulting with families about planning for caregiving, as well as the support groups that I run, I've come to realizing that caregiving is a very emotional journey, both rewarding and challenging. And the rewarding aspects can come from the time spent together with your loved one, which often result in getting to know much more about your loved one, but also who they are today. It can also be a time for making amends and clarifying any misunderstandings that may have existed for years. But there are also many challenges that caregivers experience, and it is these challenges I'm going to focus on today. I think it's both important and helpful for people to be aware of possible challenges that they may face so that they can be better prepared for how to deal with them. So, next slide, please. So, on this slide here, what you see are different emotional challenges that many caregivers have described to me over the years. And as you read through this list, I wonder if there are any that you recognize in yourself. I've heard a lot of caregivers describe these emotions over the years. And some time ago, a caregiver wrote to me about how he was coping. And he was someone who was caring for his wife with Alzheimer's. And what he wrote to me was frustration, anger, anxiety, sleep deprivation, restricted activities, separation from friends. Let that just sink in for a moment. And you can really start to sense how hard this must have been for him. It's important when trying to understand these emotions to realize that sometimes these emotions can come tied together. So, for example, some time ago when I was running a caregiver support group, and we were talking about how trying to sort of not lose patience with your loved one. And many of these caregivers would then go on to say, and that would immediately make them feel guilty. So, this idea of losing patience and feeling guilty can often come tied together. It's also important to realize that for many people, some of these emotions come at different times of your caregiving journey. And that I would say that when you're caring for someone all on your own, these emotions can be particularly strong. So, again, reflect a little bit about how some of these different emotions might be personally impacting you. Next slide, please. So, what I'm going to be talking about for the remainder of this time is what does it mean to be a caregiver? Then, very importantly, caregiver stress syndrome, the emotional stresses that caregivers typically will describe, how to manage your stress, services and resources for caregivers, and then finally, self care and hopefully getting to a better place. Next slide, please. So, what I found is that one of the challenges working with caregivers is that often people don't define themselves as a caregiver in the beginning. And this is especially true in the early stages of caregiving, where instead you see yourself as the dutiful son, daughter, or loving spouse. You're doing some food shopping, fixing a loose doorknob, reminding them of their upcoming doctor's appointment. But eventually, you're more than that dutiful son, daughter, or loving spouse. You become the one that the parent or loved one truly relies on. And in other words, you are their caregiver. It's this reliance that's so critical in this relationship. And it often comes with a lot of challenges, stress, and time taken away from your loved one's work and other social activities. And the reason why I bring this up is I always try to help the individual to recognize sooner rather than later that they truly are the caregiver, because that means they're more likely to then start reaching out for any services and resources for caregivers. Next slide, please. Caregiver stress syndrome, as some of you may recognize, is a tremendous issue, also known as burnout. And there is one caregiver that I always think about when I talk about this topic. This was a lady who called me. This was in the first few months of COVID. She called me out of the blue a Friday evening, and she started to tell me about what was going on in her life. And she was someone who was living with her parents, both 91. She was the sole caregiver. The siblings were not available, and she was burning through her own retirement fund. Parents were very recluse, would only let her take care of them, and she hadn't slept in days. She was clearly burned out and experiencing multiple stresses. And I remember at the end of that call, she thanked me so much. And really, it was just for listening. She needed someone to really, truly hear her. And I point this out because if you, as you're listening to this webinar, happen to know of someone where you recognize that they are really stressed out, please reach out, because sometimes just that call can really make such a difference. The way that caregiver stress syndrome manifests itself is often in terms of extreme exhaustion, which can be experienced physically, mentally, emotionally, and socially. Next slide, please. And here on this slide, you see some typical ways that burnout can manifest itself. And as you read through this list, you'll recognize that some of them are more physical in nature, such as significant changes in appetite or weight. Some are more emotional in nature, such as irritability or sadness, and some more social in nature, such as staying away from friends and stopping doing the things that you enjoy doing. It's really important as you look through this list to see if you recognize any of these signs and symptoms in yourself, because hopefully that will then get you to seek help. The sooner you can seek help, the sooner you can help yourself. Next slide, please. And as you can well imagine, the more stressed out you are as a caregiver, the greater the toll on your own health. And here on this slide, you have some meta-analyses looking at stress amongst caregivers. So for example, one meta-analysis found that roughly between 40 to 70% of caregivers will endorse some level of depression. A little under half will report chronic conditions. And here you see just a small listing of the typical chronic conditions that caregivers will report. One study found that caregivers between ages 66 to 96 have a 63% higher mortality rate than those who are not caregivers of the same age. So if you're asking yourself, do I really need to pay attention to my stress? Yes, you do. I really hope that these studies can really bring home to you how important it is to really pay attention to your stress level. Next slide, please. One thing that I often do with caregivers, and we're talking about their stress level and where it is at, I ask them these three simple questions. So first one being, how anxious or stressed are you about expecting to become or being a caregiver? Second one, what is causing your anxiety? And then the third one, what do you do to relieve your stress? And the reason why I find these questions helpful is one, once you get someone to quantify their stress level, it often brings it home much more. This is something I need to do something about. Also, it's really helpful to get people to think about what is really causing my anxiety. What is it that when I'm lying asleep at night, trying to sleep, and that's keeping me up at night, what are those pinpoint issues, because then you can really start to deal with them. And the third point is, how are you dealing with your stress is also important, because sometimes, unfortunately, people use not the most ideal coping mechanisms that are not good for you in the long run, such as possibly drinking too much, maybe eating too much or too little, or isolating yourself. And that's why, if you're doing things that are not helpful for you in the long run, you need to think about other coping mechanisms. I will be talking about both specific stresses that caregivers often experience, as well as ways of dealing with your stress. Next slide, please. So here, what you see on this slide are the typical stresses that caregivers have described to me over the many years. And some of these stresses you may recognize are typical of people in the much more early phases of being a caregiver, such as, I don't have a plan in place. I have no idea what I'm doing. Also, not knowing where to start, not knowing where the resources are. And for many caregivers, the sandwich generation, they are also full-time working. And so that work-life imbalance can be really so stressful, where you're feeling like you're being pulled in multiple directions. Another point that I've heard from many caregivers is this idea of self-doubt. So as you can imagine, with an aging population who are living longer and longer, some of these medical conditions that need to be treated and cared for are becoming more complex. And for that caregiver who has never dealt with any medical issues, that can be quite scary. So self-doubt is often a big stressor for many people. I would say maybe one of the most chronic issues is this idea of lack of support. Unfortunately, we're having smaller families, fewer children, more of us are living further and further away. So often you see that primary caregiver with few, if any, family resources in nearby. And that is very, very stressful. Family conflicts and disagreements, I'm actually going to be talking about that on the next slide, because this is such an issue and it is understandable. So I do want to just delve into that a little bit more on the next slide. The final point, financial worries. What I've heard from many caregivers is that they are a little shocked about some of the out-of-pocket expenditures that they're finding that they're having to provide to their loved one, such as paying for medical medication, paying for transportation, paying for services. And if you're worried about your own personal finances, then of course, with the rude awakening of having to suddenly pay for your loved one is pretty significant. AARP came out with a study, granted it's a little dated, from 2021, where they found on average people paid a little over $7,000 per year out of pocket. So again, that can be a tremendous stressor. Next slide, please. So as I mentioned just a moment, the tension between you, your family, your loved one can be pretty significant and really causes a lot of stress. And what I always point out is really try to help the family to figure out what are the specific disagreements. And, you know, sometimes it's figuring out when the loved one should go to maybe assisted living, maybe nursing home, or who should be stepping in to provide more help. The point about why often these disagreements come about is because the thing to recognize in these family disagreements is that often we have different relationships with the care recipient. So different children have different viewpoints about what is really going on. And therefore, it's not surprising that there are disagreements. The thing that I recommend is to have the loved one be able to communicate to all the people who may become involved in the care plan, communicate at the same time, what are your needs? What are your wishes? so that everyone hears it at the same time. So hopefully there's less room for disagreement. But, as in with everything in life, try to apply best practices when you're in disagreement. Listen, provide feedback, making sure you're hearing the other person correctly. Express empathy. It's hard on everyone. And also demonstrate flexibility. The one thing I will say is that for some people, some primary caregivers, they will tell me it is just too stressful for me to try and include my siblings. And so what I recommend in that scenario is to have that individual primary caregiver provide updates, possibly by email, once a week, maybe once a month, about what is going on, so that the other family members, if they do step in at a later point, they know what has been going on, and therefore it'll make it a little bit easier for them to step in. Next slide, please. So on this slide here, what you see are ways of managing your stress. And these are different coping mechanisms that I've heard over the years, and it runs the gamut. The key point about this is that you need to figure out what works for you. We are all very different. Just case in point, if I'm stressed out, I go for a long walk, long, fast walk. Whereas if my husband's stressed out, he takes a nap. So it's two very different coping mechanisms. One shout out that I really want to give is to caregiver support groups. If you've never tried one, I would really recommend you to try one, because what I've found in these caregiver support groups is being amongst people who really get you, who understand the stressors, the sort of the reality of caregiving can be enormously beneficial from an emotional perspective, but also from a practical perspective, because you will often, they'll share, what are the resources, what are some of the potential barriers out there, how to handle a challenging care recipient. So they are enormously beneficial. And if you don't know already, you can go to your senior center, you can go to your council on aging, and you can either go in person or do remote caregiver support groups, and they are often free. But the key point is to really give yourself some time, reflect on what can work with you. And sometimes a certain coping mechanism gets old. So one caregiver once told me that she didn't find that walking was working for her anymore. And so we in the caregiver support group tried to problem solve about other ways that could help her distract and diminish her level of stress. Next slide, please. So on this slide here, you see, and I like this slide because it has very much step-by-step recommendations about how you might manage stress. And you'll see that the source is from Springwell, the Aging Service Access Point that covers the area that I live in, which happens to be Newton. But what is nice about it is if you're struggling a little bit about, I can't think of other ways that I should manage my stress, try some of these different mechanisms. Some people hadn't thought about maybe doing a jigsaw puzzle. Some people hadn't thought about, very deep, slow breathing exercises. But the main thing is try different things and see how they feel with you. Next slide, please. So here on this slide, you have various services and resources that are available in the community. And it's important that you recognize or that you realize that these exist. I do still come across caregivers who have no idea about the tremendous amount of resources available in the community. So a home health aide, a personal care assistant, companionship. And I do want to just point out, for some people, they're a little bit like, do I really want to pay money for a companion? And my argument is if you can afford it, absolutely. Because as we all remember, is how COVID impacted, especially older adults living by themselves. They became very isolated, very lonely, and it really negatively impacted both their physical health and their emotional well-being. So it can be money well spent getting a companion who can really spend time, get the loved one to talk about the things that they love doing, or do whatever activities that they love to do. Other things to reckon, and the important point to recognize is that these in-home services can be arranged according to your needs, whether it's an afternoon, whether it's several days a week. It depends on what your needs are as a primary caregiver and also the care recipient. Out of home care services, many people don't know about the existence of adult day centers, and they can be a godsend because they're relatively cheap compared to, let's say, a home health aide or a personal care assistant. And they enable you to have your loved ones stay in a facility where they have various activities, they're given meals, and they get to socialize. And they can spend most of the day there. You can arrange for transportation. Some people find it more easy to drop off their loved one themselves. Other people get a lot out of memory cafes. So if you're caring for someone with some form of dementia, it gives you an opportunity to meet other caregivers who are also caring for someone with some form of dementia. And then finally, skilled nursing facilities. If you're at a point where you need to take time off, let's say you need to go off somewhere for several days. I had one caregiver who needed to go to California and she needed to spend a whole month there. And she then had her mom placed in a skilled nursing facility and was very relieved to find this opportunity because it gave her that flexibility. Yes, these resources do cost money. Most of them, memory cafes, are free though, but most of these do cost money. But the key point is if your health is really suffering because you are so worn out and really experiencing a lot of stress, it is critical to give yourself a break because you want to make sure that you're there for your loved one for absolutely as long as you're able to, and you want to give them the optimal care. So you need to pay attention to your own well-being. Next slide, please. So this slide I'm going to go through fairly quickly, but the key point is I've come across many caregivers where they're at the point needing to hire an aide. And some of the stumbling blocks I have found is that after the second or third aide, it generally works. But my key point is to get them to really think through more carefully what questions they need to ask of the agency so that hopefully the first aid that comes to the home can work out. And so the two things that I really get people to focus on is who is the client, as in who is your loved one? What is their personality? What are their interests? But very importantly, what are their needs? So that when the aid comes to the home, they can really help with the needs of your loved one. You can't make any assumptions. And the other thing that sometimes is relevant is if you, as the primary caregiver, work best with someone who can sort of think on their own 2 feet and don't need to keep asking you specific questions, you might be able to put that in as an ask for a caregiver. Alternatively, if you're someone, the primary caregiver, who prefers to have an aide who really comes to you all the time and checks in with you to make sure, is this what you want? Is this now the time to give some water, whatever? Then you need to spell that out. So it's a little bit assessing who the client is, as in the loved one, and who you are, who you work with. You can see these questions here, which are some of the ones that I recommend over time. Next slide, please. So here, the main point is, and again, I emphasize this all the time, is your own self-care is so critical. And sometimes people don't think about the breadth of sources of help. We sometimes tend to assume that really we can only turn to our family. But I think in today's world, we have to be more creative. So sometimes reach out to your friends, your own personal friends as the primary caregiver, or possibly, if suitable, maybe your loved one has some friends that are still able to provide maybe some emotional support to your loved one. Also, know who the neighbors are around where your loved one lives so that you can call them and say, I've been trying to reach my mom. I can't get a hold of her. Would you mind just knocking on the door and making sure she's okay? Religious spiritual groups often is a wonderful resource for volunteers. And then, as I mentioned, caregiver support groups is something that can really go a long way for supporting you emotionally. And on this slide here, you have some resources online that I find very helpful. The other thing which I have not listed here is, go and look at your senior center, look at their website, find out the resources that they provide. Go to your aging service access point, find out what resources they have. Call and ask. There's always, there's no wrong question to ask, and they will guide you in the direction if they think that they're not the best people to address whatever specific issue you have. Okay, next slide. So I'm hoping that some of these suggestions that I've given you can help you get to a better place. But just to recap, one is to think strategically about what is your biggest challenge or challenges. Label them. That helps you to work on them. Also, another thing which I haven't really talked about, and that is this issue of also think about what is important to you and your loved one, because time is so meaningful. And I'm speaking about this from my own personal experience with my mom who passed away 14 years ago. I now regret not having spent more time asking her questions. There were some things that only she could answer. So reminiscence can be a wonderful way to do this with your loved one. And as I've addressed, really think through what are ways that helps you cope better with your stresses. And then finally, I'll end it by saying that it is important that you consider this a stage in your life, and that you need to try to be as patient as possible and to give it time to get to this level of acceptance. Because in the beginning, it's very hard to accept that, let's say, whether it's your spouse, whether it's your older loved one, whether it's your parents, that they're now deteriorating. That can be so hard to accept. But give it time, talk to others, reach out for help, and that hopefully will help you to get to a better point of acceptance. And thank you so much. Next slide. That is it.
Thanks, Julie. If we could just go to the next slide, please. Hi, everyone. I'm Deanna Nourai, as was previously mentioned. Thank you for all the work that you do caring for your loved ones, and thank you, Julie, for that wonderful presentation. So I'm just going to go over a little bit of resources that are available at the state level. One of the big ones that we will mention that Julie talked about is your aging service access point. But first, I want to start with behavioral health outreach for aging populations, or BHOPE, as they're called in the state. We love our acronyms. And this is a program, and it's run through some ACEPs, through some COAs and senior centers in a few different locations. It's not necessarily statewide, as you can see in this map, but it is in a lot of different towns and cities, and hopefully expanding. So through the program, behavioral health clinicians work with older adults experiencing emotional challenges and they can come to you, which is a really big benefit. They can come to the home of the older adult that they are assisting. And it is free for older adults age 60 and older with symptoms or challenges related to mental health. And for those that are interested, we urge you to see if they're available in your area, call Mass Options at the number provided, and again, just see if they're available in your area and can serve either you or the individual that you are caring for. Next slide, please. So another campaign that the state had was a What's on Your Mind campaign. Hopefully you've seen this image or one similar to it. They were out and about on billboards and such across Massachusetts. And it was really to encourage residents to take small proactive steps to support mental health and mental well-being, to reduce stigma around mental health issues and burden, and to provide resources when they are applicable. So if you go on this website, mass.gov/what's on your mind, you'll find different areas. There's caregiving, there's older adults, there's caring for young children, there's different areas and how you can look at it and navigate those to support well-being and guidance for asking for help and some next steps. Next slide, please. And lastly, I just want to mention the Massachusetts Behavioral Helpline. If you need assistance or know somebody who needs assistance, it's this phone number that is available 24/7. It is there to help individuals live. You will talk to somebody and be able to get, at least a next step, because we know that that is often one of the biggest challenges, is looking for that next piece. So this helps connect Massachusetts residents and families to treatment, including outpatient care, urgent support, and crisis services. Do want to mention, of course, if somebody is having suicidal ideation or suicide tendencies, that they should call 911 if it is an urgent situation like that. But anyone can use this Massachusetts Behavioral Helpline. Anyone in Massachusetts, it's available in over 200 languages, and it has trained individuals who will respond. And again, the phone number is listed on the slide, and that you can chat it online too, which is a really cool feature, and that's masshelpline.com. So again, just want to echo everything Julie said. Thank you for all the work you do that is often, I'm sure you feel often taken for granted. We appreciate you here and all the work you do for your loved ones, as you are their caregivers, and that help is available and you don't have to go through it alone. And with that, I will pass it back over to Liz. Thank you, everyone.
Thank you so much to Julie and Deanna for those wonderful presentations. So now, let's see. So I know we've covered a lot of information, and I just wanted to reassure you all that you don't have to absorb all of this information at once. We do post all of our webinars to YouTube. So we're going to post the YouTube channel in the chat, but I would keep on the lookout for this webinar in the next week or so, and we'll send a follow-up email once the YouTube video has been posted. So now I'll lead us through the Q&A session. So again, while we welcome your questions, please note that we will be addressing general topics rather than highly specific or personal situations. And if you do need that individualized guidance about services and supports in Massachusetts, we do encourage you to reach out to Mass Options. Mass Options is a free service that refers older adults and caregivers and people living with disabilities to local supports and services. And one other state support for caregivers that I wanted to quickly highlight is the Family Caregiver Support Program, if you're not already familiar, which connects family caregivers with a caregiver specialist to provide information, tips, and resources and other means of support, and helping you to create that customized care plan. So we will post those resources in the chat now. And taking a look at some of the questions that we have received in our pre-webinar survey and also in the chat. The first question I have for Julie is, so individuals often want help from family members or neighbors or loved ones, and people are often asking them, how can we help you? What are some concrete examples of asks that caregivers can make of family, friends, or neighbors when they're asking how can they help them?
Okay. So I'm actually hearing that question in two slightly different ways. One is people will often say that sort of friend will say, "Oh, let me know if I can be of any help." And in that scenario, people are well intended, but they're not going to do anything until you ask them specifically.
Mm-hmm.
And I believe I did see in the chat that someone put this idea of have a list.
Yes.
So have a pre-planned list so that when someone does make that offer, you then say, well, it would be super helpful if on whatever day you go food shopping, would you mind just adding these few items to your list? The other thing that I've found is that if you're going to reach out to other people and make that ask, to really try to think about what that individual skill set is.
Mm-hmm.
So that if someone who happens to be really good at numbers, then they might be able to help you with the finances. And what I mean by this is people are more likely to offer and be willing to help if you ask them already about something that they feel comfortable and confident
Yep.
at doing. So try to know your audience and then sort of pick what the request is based on what their skill set is.
That's great. Thank you so much. And another question we have in the Q&A box. So we talked about hiring like a companion. Somebody's asking about companion care when a loved one is already in a care facility. So I'm assuming if somebody is living in an assisted living or a skilled nursing facility, do you have any thoughts on or experience with people hiring a companion to go into those facilities?
Absolutely. And to be quite honest, I'm always a little shocked. Not so much now, but in the beginning, I was a little shocked because I know how expensive it is to have a loved one in one of these facilities, whether it be assisted nursing home. But invariably, I'm coming across more and more people, especially someone who's having behavioral issues, that the
Mm-hmm.
staff at these facilities just simply cannot address all the needs of your loved one. And that people will then hire someone to come in, often during meal times or during sundowning can be an issue, especially with people suffering from some form of dementia. So
Mm-hmm.
so it is quite common to recognizing that your loved one needs additional hands-on help beyond what the staff at these facilities can provide.
Great, thank you. And Deanna, I have a question for you. So for someone who's worried about an older adult's mental health, but isn't sure what kind of help is available, where would you recommend that they start if they're having concerns?
Yeah, that's a really great question, especially because, this is your loved one. You are not necessarily a mental health professional, and
Mm-hmm.
you may know some of the signs, but you may not. So I would say make sure to, call Mass Options. I think that's a really good starting point. They will be able to tell you if there's a B Hope in your area that could do an assessment. You could also contact, and they'll put you in contact with your local ASAP. You can also always go to, the primary care physician of the individual and say, this is a concern we're having. Can you recommend somebody? Because a good place to start is always talking about what's going on. And your loved one may not feel comfortable necessarily telling you everything, or they may, but talking to their primary care physician can get you a referral to see a mental health counselor. Then they'll be able to do the assessment and take it from there, because talking is always a great first step.
Perfect. Thank you so much. And we just had a comment in the chat that I thought might be helpful to the larger group. Someone noted that hospice was so helpful when my mother-in-law was in assisted living. They provided nursing, volunteer visitors, and more at no out-of-pocket costs to me. So that also is a great resource. And I know there can be some different stigma around hospice and palliative care. But I will say we do have a speaker potentially in the next coming months to do a webinar on some of these topics. So that will be something to look out for. Julie?
And can I just say one additional thing is
Yeah,
as you point
of
out, there's a lot of
course.
stigma and fear around bringing up the topic of, let's say, hospice. The important point to make sure that your loved one understands is you can exit hospice if you want.
Mhm.
And that sort of diminishes some of the anxiety, because people feel like, oh my God, this is my final step,
Yep.
and don't recognize the enormous amount of support they get. But if they are told up front, you can leave this program, they're more willing to at least try it.
That is such a great point. Thanks for bringing that up, Julie. And let's see, another question for Julie. So when family members disagree about care decisions, or one person feels like they're carrying the majority of the load, what would you say is a first practical step to get everyone on the same page in a family?
I think the primary thing is, so let's say you're the primary caregiver, you're getting more and more worn out, you're recognizing I can't do everything. Sometimes you do need to help the others who are not in that caregiving role to really recognize the toll it's taking on you. And I've heard from many well-meaning family members who will unfortunately say to the primary caregiver, well, how hard can it be? You're home all day. So sometimes you really do have to help them understand it is not as easy as you think. And the second thing is to you yourself, the primary caregiver, express that you understand it is also, you may not totally believe it, but you yourself recognize that they're stressed out. So you expressed empathy. If you express empathy to the other family members, that may sort of diminish some of the tension.
Yeah, for
And
sure.
as I said on the slide, that typical, good listening skills, also feedback. So because miscommunication can often come from just not hearing each other. So by doing the feedback, you're making sure that I heard the other person correctly.
And we actually have another comment in the chat about hospice. And Julie, I'll pose this to you, but if I know we have a potential webinar coming up on these topics, and we can follow up with resources. But somebody's wondering, has there been a transition with hospice care? My understanding years ago was it was end of life care and managing pain. Today, it seems like hospice is called in earlier to help create a plan of care. Is this true? And when should you think about contacting hospice?
I have to be perfectly honest, I'm not 100% sure.
Yeah.
But I suspect that this individual's understanding is correct, that hopefully the doctor, the primary care physician, not all primary care physicians, unfortunately, are as comfortable talking about hospice, but absolutely the movement does seem to be that people are realizing we need to start talking about this. Typically, you enter hospice within 6 months of your expected that you are no longer living. But there is a lot of wiggle room. Some people, after the 6 months have gone by, and they
Yeah.
continue. But really, I would strongly recommend to family members to learn about hospice, whether it be with conversation with other people who've tried hospice
Hmm.
and or your medical provider, and really start thinking through about making this. And hospice can be provided in the home, or it can be provided in a facility.
Yeah. Yeah. And I can see, I know we will probably be touching these topics going forward, but I can see if there's a resource I can put in the follow-up email to this webinar, given that there's a lot of interest around this topic. And then we have a comment in the chat that might be helpful to the larger group. Someone noted that pre-planning, having a family meeting with your loved one while they're still able to care for themselves and asking them what they want. So definitely that family meeting concept.
And I have a quick comment about
Yep.
that. Not so long ago, I heard about this thing called the 40-70 rule. It may be 40-70 or 70-40 rule. And the premise is that ideally, you should be addressing this idea of what are your older loved ones' wishes and needs when they're in their 70s, meaning that invariably you're in your 40s. Because if you start talking about these issues about, what do they envision, what do they want early on, before there are major medical, physical limitations, you're probably going to be able to make much more headway than if you wait till when you're in that crisis mode. So the
Yeah.
40-70 or 70-40 rule is quite an interesting one.
I love that. I've never heard of that concept before, but that's a good
Yep.
rule of thumb
Yep.
and it's easy to remember.
Exactly.
And let's see. Um, for caregivers who feel very overwhelmed and don't know where to start, what would be, I'll pose this to both Deanna and Julie, what would be the first thing you recommend after today's webinar? So they've come to this webinar, they've heard all this information. What's one next step that you would recommend?
Deanna, would you like to take this first? And I can.
Sure. I think, this is a great first step already. I think signing up for the future webinars is another great step. Looking and seeing if there are any support groups in your area, getting, figuring out what's best for you. I think finding the steps that you can do at home, again, like breathing exercises or finding what calms you down and taking a minute to really reflect on that so that you have that in your back pocket when you need it. I think that's really important. And then also just being able to, make a list of resources. You may not be able to call mass options today or have the time, but knowing the number for when you are available to call them, I think is a good step.
Fantastic.
And I can just add a little bit to that. And this is directed more towards that audience of caregivers, right? They're right at the very beginning phases where they are starting to worry about the well-being of an older loved one, but just don't know how to approach them and how to start this conversation. One of the things that I talk about in another webinar that I give, which is more around the practical aspects of caregiving. And the key thing to think about is who's the best messenger? And it may not always be you, the adult child. And the second thing is to think about who they are. So let's say your aging father. Do you reach out to him and express your concerns very directly and say, I am worried about X? Or do you do more indirectly, meaning that you say, well, my friend Sally's parents are now thinking about downsizing, and they found this wonderful place. And then you can sort of wiggle your way into, well, what about you, mom and dad? What have you thought about?
Yeah, I love that.
And all the main thing about all of this, that it has to be an ongoing conversation because things change for the individual or individuals, and you, the family support system, because what you say you can provide in terms of support on day one may look very different in half a year's time because your family situation has changed. So you need to ideally try to be as flexible and cooperative as possible in this whole journey.
Perfect. And thank you so much. We have some really great positive feedback about the webinar and how useful it's been in the chat. So I just want to once again thank you so much to Deanna, to Julie, to our interpreters today, to our cart provider. We really appreciate all of your efforts and also everyone being here today. And that's all the time we have for questions today as we're approaching 1 o'clock. And as you exit the Zoom, please do take a moment to complete the post-webinar survey. Your feedback is greatly appreciated and helps us to improve future sessions. And I hope you all have a great rest of your day and stay cool with this heat we're having. Thank you all. Bye.